My name is Christian Johansson. I'm a physician assistant at Tidewater Orthopaedics. The rotator cuff is a muscle of four called your sits muscle in your shoulder. S stands for supraspinatus, which is right on top. I stands for infraspinatus, which is at the bottom. The T stands for teres minor, which is right at the bottom of the infraspinatus. And the S is a muscle in front called your subscapularis. All of those assist with stability in the shoulder, but one of the main functions is to move your shoulder so you're able to reach overhead, reach behind your back, and be able to perform sports activities and any activities of your daily life, such as cleaning or doing dishes or just playing with your kids. Rotator cuff tears in the shoulder is caused by one of the two things. It can be a traumatic type of tear where you have an injury such as a fall or lifting something heavy, or it can be caused over time in a chronic type of degenerative tear that frequently happens if you have bone spurs in your shoulder that digs into the rotator cuff, or you perform repetitive activities for some time that degenerates the tendon and causes a tear. We frequently see it in people over the age of 40, and it gets more common as we age and get older. The tears are usually diagnosed with MRIs. Sometimes we have to do other imaging depending if you're able to undergo an MRI or not. The most common signs and symptoms that we frequently see is pain and lack of function or a decrease in strength. A lot of people will often ask us when we diagnose them with a rotator cuff tear if they can heal on its own, and the answer depends. A lot of tears can heal if they're small enough, and if we do injections or physical therapy, they can get healed by your body and regenerate. If it's a larger tear or falls in the category of what we call full thickness tear, they don't always heal on their own, and sometimes people do need surgery. A decision for surgery is usually made after we've tried some cortisone injections, we've tried physical therapy, and we've tried rest for a minimum of 6 to 8 weeks. And at that time, if you do have a rotator cuff tear, it's not getting any better, it's likely that you will need surgery to fix it. The surgical options for repairing a rotator cuff ranges from an open procedure or a mini open procedure to arthroscopic. Here we do arthroscopic surgery, which is a minimally invasive type of procedure where we use a small incision, we put a camera and some tools into your shoulder so that we can look around and fix anything that needs to be fixed. The recovery period from this is frequently between 3 to 6 months. Most people will do physical therapy for about 3 months, and they can then get back into some of the daily activities with full lifting and heavy lifting somewhere around 5 to 6 months. Thanks for watching Tidewater Orthopaedics. Check out our next video.